Do you feel pain just below your kneecap every time you squat, jump, or go for a heavy clean? That sharp or nagging ache could be a sign of patellar tendinopathy, one of the most common overuse injuries in CrossFit athletes. I'm Dr. Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehab, where I help CrossFit athletes over 30 stay strong and keep training even after an injury. In today's video, we're going to cover what patellar tendinopathy is, where the pain comes from, and 3 key tips to rehab it the right way. The patellar tendon connects your kneecap to your shin bone. It's responsible for transferring the force from your quads to your lower leg, helping you jump, squat, and lift. Patellar tendon pain, often called jumper's knee, usually shows up right below the kneecap. It typically gets worse with loading, especially during jumping and squatting, and can be aggravated by going up or down stairs, and it may feel fine at rest, but flare up during or after your workout. Here's what most CrossFitters experience: pain at the bottom of the kneecap with squatting or jumping or even lunging, stiffness or pain when warming up that might lessen during the workout and then come back afterwards, difficulty with Olympic lifts, especially pushing off the floor and during the receiving positions, and then increased soreness the next day that limits their ability to work out again. This pain is typically a result of spiking intensity or volume for any impact activity, and as a result, that tendon becomes overloaded from stress and unable to withstand the demands of those impact activities such as running, squatting, or jumping. Tip number 1, modify the activity, don't eliminate it. Total rest is not the answer. In fact, tendons need load to get better. We recommend sticking to a pain monitoring model where you're keeping pain levels under 3 to 4 out of 10 during certain movements. So what we recommend in this case is try decreasing your squat depth temporarily, swapping out box jumps for sled pushes or more bike intervals at a higher intensity, or adjusting clean or snatch volumes. Tip number 2, begin isometric loading to calm down that tendon. Low load, long duration isometric exercises are great early on for reducing pain and building tendon work capacity. We recommend starting with certain exercises such as AA wall sits or Spanish squats for 4 sets of 30 to 45 seconds at a low level of resistance and intensity, doing this 2 times per day, so once in the morning and then once at night. And then again, keeping effort moderate. Again, in this case, it is okay to get some low-level pain or discomfort as long as it is not going above a 3 to 4 out of 10. We do not want to be completely pain-free with these exercises. So again, some mild pain discomfort is tolerable. Tip number 3, gradually progress strength and plyometrics to build tendon stiffness. After low-load isometrics are well tolerated, we would progress to heavier single-leg isometrics, such as 3 to 4 sets of 10 to 15 second holds at greater than 70% intensity, and this could be done through leg extension machine isometrics or split squat isometric holds to further build tendon stiffness. Next, we might add in some slow eccentrics like tempo goblet squats or step downs, and then start to work towards full range, heavier squats and single leg strength movements. And the final piece is layering in some more jumping, Olympic lifts, or other previously provocative movements. So remember, it's not just about getting stronger. We want to build tendon capacity and stiffness over time. So if your knees are barking during squats or cleans, don't ignore it. Respect the current pain threshold you have, gradually reload the tendon, and progress with intent. Like, subscribe, and drop a comment if you've dealt with patellar tendon pain and what movement bugs you the most. Remember, patellar tendon pain doesn't mean your training has to stop. In fact, it should absolutely not stop. Control the load, rebuild the tendon, and then build back your level of comfort with certain movements that are previously painful. Text pain-free to the number below to get back to RX workouts and training without modification by looking at our RX Blueprint Guide.